Welcome to the HFMAtalk podcast, the podcast for NHS finance. I'm Alex Hunt, and today we're bringing you the first episode in a 3-part mini-series on our recent annual conference. Every year, the HFMA puts on the annual conference for healthcare finance professionals across the UK. In December 2025, we returned to London to deliver one of our biggest and best conferences yet. Across 3 days, we hosted a programme of inspiring and engaging keynote presentations from healthcare leaders and policy influencers, alongside panel sessions and discussions led by members working across the service. Today, we're focusing on day 1 of the conference, which traditionally centres on the outgoing HFMA President's theme. Lee Outhwaite, Chief Financial Officer for NHS South Yorkshire Integrated Care Board, has been the President for the 2024-25 period. His theme was Values and Value. Here's what Lee had to say about his theme at last year's annual conference.
So my theme for my HFMA presidential year is around values and value. So it's about looking backwards for the NHS's and HFMA's 75-year history and thinking around what values do we need to propagate from the past. So there's something about what was really good in the past versus what bits of it do we need to improve. I'm thinking specifically about EDI and the shape of HFMA membership and how do we make it sure it represents the communities we serve. It's about looking backwards, but it's then values and value. It's also about looking forwards, and it's about going, crikey, we now occupy a really complex world. And what does a value-based healthcare system for the future really look like? So it's both looking back and looking forwards, celebrating the 75th anniversary year.
It has been a turbulent year, not just for ICBs, but for the healthcare finance community as a whole. We'll catch up with Lee later in this episode to hear how his theme has evolved over the last year. But back to day 1. Where the sessions revolved around values and value. We heard from Dr. Amar Shah on how we can build shared purpose and vision across our organisations and systems. We also delivered our first ever HFMAtalk live session, which will be released in the new year, where Maddie Palmer, Nikki Briggs and Jennifer Keaton explored what value really means in today's health system, beyond the balance sheet, and how finance teams can shape long-term plans that support better outcomes, resilience and collaboration across systems. After these insightful sessions, I caught up with some of our delegates to discuss what values and value meant to them.
My name is Andy Cullion. I'm the Head of Financial Management at Great Western Hospitals.
Brilliant. Thank you very much for being on the podcast today. What do values and value mean to you within a healthcare finance setting?
I think values, as the panel just said, really, it's about putting the pound in the right place. So it's making sure that we get maximum value for every pound that is spent within the NHS, and obviously that means then the best outcomes for patients at the end of it.
And do you think there is any kind of work to be done on value within the NHS? And if so, do you have any ideas on how that could be applied?
I think the main thing really is that we're focusing efforts in the right places. I think at the moment we're probably too guilty of spending an awful lot of time, and I think it was mentioned there, looking back retrospectively on what we've done, always focusing on near-term, very short-term goals, when actually we need to start refocusing on what is the medium to longer-term priorities, and a lot of that is going to be around healthcare prevention and the demand management, and then really focusing the pounds on what are the key themes, the key topics that come from the general health of the population, and how we can sort of frame the finances around that, really. So I think there's lots we can do, and as they mentioned there, the costing accountants and the role of finance is absolutely key to achieving that.
Hi, I'm Nazira Taylor. I go as NADS, and I'm currently a Financial Governance Manager at Oxford University Hospital Trust. I think the main thing is putting it patients first. I think a lot of the time working in finance you can get lost in the numbers, but the main process and element of it all is that the patients are at the focus and at the centre. And that's the driver, or should be the main driver. And I think it's difficult, especially when finances and the way that the world's working is getting more difficult to put patients first. But yeah. I think, in today's HFMA conference thus far, they've mentioned a lot on costings. It's an area that's new to me also, but I think it's very interesting and can be honed onto more. I think looking at patient pathways and having a clearer insight as to how much an individual costs us from walking into the doors to leaving the doors and the aftercare and everything else, and making it more financially literate for people to kind of see without it being or putting it in layman's terms, will make it easier for the individual gauge whether you're in a finance role or not. So I think that would be definitely an area to improve on.
Yeah, so value, if you like, from a citizen stroke potential user of the NHS is really getting care that's centred around myself. And it's all about the transition, I think, from fixing me when I'm unwell to keeping me well for as long as possible, and me sharing in that responsibility and driving that through. Yeah, I think we just discussed this slightly earlier, but I think it's bringing the clinical and non-clinical processes within the system in a patient-centric way could improve lots of things in terms of value, because it's all about consumables, whether those consumables are people's times or it's commodities. And unless we understand the source of those usage of those commodities or people, and then align those to the provision of them, i.e. the front office and the back office within the healthcare system, if we don't get that working better than it is now, we're going to struggle to improve value, I think.
In the second half of the day, we welcomed USA HFMA Chair Kieran Bathesia and HFMA Australia President Murray Brown. They explored the common challenges and opportunities facing finance leaders across different countries, offering practical perspectives on driving change within their systems. I caught up with both of them after their sessions.
Murray Brown, the current president of HFMA Australia.
So I'm Kieran Bathesia. I am the Voluntary National HFMA Chair, US, for 2025-2026. And I'm also the Director of Patient Registration and Financial Counseling at University Hospital in Newark, New Jersey.
How is the concept of value shaping the way finance leaders in your country are tackling big issues like prevention, health inequality, sustainability, and what kind of parallels do you see with the UK?
I mean, the parallels are there. We're grappling with very much the same issues at the moment. I think we're a little bit behind in terms of the journey that I think the UK is going on. So it's the same issues, it's the same challenges. I think, the conference today really started to shape some of the definition around what value actually is, and I think that's a starting point for us is how do we actually define what value is, and value to who, I think is really important. So, the value for us as finance professionals is quite different to, our patients on the ground. So I think that's the place we've really got to start, is to define value, and then we got to start shaping funding models that can really start to draw out the value out of our system and not just incentivise throughput, which is unfortunately where we currently are at the moment.
So I think the US and the UK are similar in the standpoint. I would suggest that data be a way of driving change. From the standpoint of the more information you have, the more transparent you can make it, the more individual you can bring to an organization or to a colleague. Driving that change through data helps normalize the conversation. I think there's value in doing that. I think the opportunity also for the finance professional is to partner with the clinicians and with the different stakeholders. In the US, for example, it's insurance companies, it's clinicians, it's other non-healthcare providers to support the patient experience is an opportunity. And I think at the NHS, you have similar opportunities from that perspective, albeit without necessarily the insurance companies.
And how big of a thing is value in the agenda on the agenda for the US at the moment?
In the US, we are primarily fee-for-service, but we have organizations that have embraced value-based contracting, value-based payment models, and shared savings models. The federal government, through CMS, Centers for Medicare and Medicaid Services, which is the program for Medicare and Medicaid for anybody over 65 or the underinsured or the financially uninsured. Those folks they have programs designed for shared services, shared savings model. It is growing. It is not a perfect model by any means. However, it continues to evolve, and I think that's where we need to move to be able to bend the cost curve.
And could you maybe kind of outline some of those common challenges that you think that our two countries are facing in the healthcare finance community?
Yeah, I mean, I think we're grappling with demand. I think the burden of disease in terms of our populations and is really kind of critical at the moment. So, how do we start to fund more preventative measures to start trying to reduce that demand on our services? The other one I think that we're sharing in common is some of the inequality in the system. So we've got diverse populations that have very different health outcomes in Australia, and I know that's similar over here. So how do we actually start to fund the needs of some of our greatest disadvantaged communities to start trying to lift that profile in terms of their health outcomes, and how do we start closing the gaps in relation to those?
I think embracing technology, struggling with limited resources and where to prioritize where we put resources, I think is one thing. I think the UK, from what I understand, is less fragmented than the US from a standpoint of their standardization, or there's opportunities for greater standardization. Within the US, there's opportunities, and we've done that standardization, but it's done within health systems, or it's done within a region. It's not necessarily across the entire nation. So that's where there's opportunities from that perspective.
Brilliant, thank you. And then kind of looking at the challenges and the opportunities that we all face, what insights or practicalities do you have that could potentially help UK finance leaders create more value in their organisations?
Yeah, I mean, it's a question I don't think anyone's answered, and if we had all the answers, I think we'd be in a different place right now. I think it starts with partnerships and it starts with collaboration. I think there's never been a more important time for finance leaders and professionals in our organisations. So to me, that creates an opportunity to start working with our clinical partners and our consumers and our patients and start redefining the healthcare that we're delivering. We've got burning platforms everywhere, so it's an opportunity to shape the future of our systems. Because if we don't, I worry about what we actually are leaving behind in terms of the legacy of our healthcare system.
Oh, I think, like I was saying earlier, using data and embracing that change, looking at the opportunities for innovation, incorporating AI into innovation is going to help drive the future. And I think keeping the North Star of the patient at the center of our care is always going to be critical to future success. But certainly, I think the biggest similarity is we all have that common goal of improving healthcare within our communities and to our patients, but making sure that we have an opportunity to do it in a way that's cost effective. So we're getting the biggest opportunity for our dollar, for your pound, to really make sure that we're maximizing the value back to the consumer.
You spoke a lot about environmental sustainability in the talk there, and it seems to be very high on your agenda. Can you talk a little bit about that and how it can apply value to the HFMA, to healthcare finance overall?
Yeah, so I probably I put my hand up to take on the portfolio in our health service. Really around the birth of my son, so starting to reflect on the world is a bit wider outside of just the health system in terms of what's the world we're going to leave behind for our future generations. And I think that's coming through in a lot of our staff as well. They see health as, it's not even health is a big contributor to the pollution around the world. It's terrible in terms of what we do to the environment on a daily basis. So starting to shift that narrative in terms of, and starting to change some of the behaviours that we've ingrained in our system to look at those factors, I think we start to then drive value across our system. So by bringing those pieces together, I think we'll drive more value out of our system and we'll get recognised for more value in the system. I don't go a day when our public health physicians aren't telling me that the impact that the deterioration in our environment will have on the health of people. We've already got a system on its knees in terms of meeting the demand coming through. The deterioration in our environment will add significant burden of disease into our communities. So to me, we have to start being part of that solution.
But I thought it was really interesting. You spoke a lot about kind of digital transformation and how transformation is key and how it's a key long-term investment. Do you think digital transformation in particular is kind of the massive value impact needed for healthcare systems right now?
I think it's going to have to be, only from the standpoint of there's only so many resources, so many dollars, so many pounds in the system that we have to be able to maximize efficiency. Right? And the only way we're going to maximize efficiency is by getting more productivity without losing the patient care and the patient-centered care in the center of that model, right? So how else are we going to do that? It's not going to be for more people, resources, but it's being more efficient and effective with those resources. And that's where AI is going to be able to come in and take out some of the, I'll call them routine, consistent, activities out of the system, reducing waste sometimes, or reducing the amount of manual intervention wherever possible without compromising quality. And in doing so, you're going to free up resources or make resources available that are going to be able to do other types of functions that are going to be more value added. Right now, we're using resources to do things that aren't necessarily value added to the patient or the consumer or to care, preventive care, for example, versus what we're doing now. So I think that's where the opportunity is for AI. So there's definitely a role. It's coming. The other opportunity I see is in medical education. I think that the students of today are learning much differently than I learned, than you probably learned, and that previous generations have learned. I think that automation is going to help in terms of their productivity and their ability to connect with patients and serve patients.
After hearing from some of our speakers and delegates, I wanted to get a policy perspective on value, what it means in practice, and how it's shaping national conversations across the service. So I caught up with Debbie Patterson, Senior Technical Manager at the HFMA, to get her insight.
How important do you think it has been to frame the last year of the HFMA around values and value?
I think it's been really valuable to remind us about the importance of value over the last year. It's very easy in tight financial times to focus on the pennies and doing more, and especially with the emphasis on productivity and doing more for less, or doing as much activity as you can, that actually sometimes it's the outcome of that activity always it's the outcome of that activity that's really, really important, and that's what value encourages us to think about.
A lot of the sessions today spoke about some of the kind of challenges when it comes to measuring and implementing value. What do you think some of those challenges might be? I
think it is hugely challenging to measure value because you are talking about outcomes, and that is an entirely subjective thing for everyone. And the outcome from a clinical point of view is probably quite different to the outcome from the patient's perspective. I've heard stories before of, outcomes from heart operations. Clinicians think it's marvellous, it's all gone beautifully well, but the patient can no longer walk their dog, for instance, and therefore for them the outcome isn't so marvellous. So it's really, really difficult to measure. It's because it's so subjective, but it's something that we really need to think about, because it's important to look at the outcome for the patient. That's the most important thing.
As the day drew to a close, I spoke again with outgoing President Lee Outhwaite to hear his reflections on the year. Obviously, you've spent the year championing the theme of values and value across all the nations, and after such a turbulent year for the NHS in a way, has your perspective on how we can embed these into practice evolved?
Yeah, I think it's evolved quite a lot through the year, to be honest. I mean, it has been a blooming challenging year. It hasn't been lost on me doing those regional conferences. Just what a tough time a lot of the HFMA members are having, and that isn't an England-centric thing. That's in Wales, Scotland, Northern Ireland and England. There is an enormous amount of change and challenge. I do think there's been something, though, absolutely about the theme about what can you embrace looking back and the good stuff, and how do you pull that forward? And I have been trying to stress all through my presidency, I do think we need this paradigm shift about how we manage NHS services in a more value-based way. Of course, productivity is important, but we've got to get into a conversation about over and under utilisation of healthcare resource, the whole U-shaped curve of healthcare demand, and trying to prioritise supply to those people that most need it. And it feels like, notwithstanding the challenges, they're pretty core messages to carry forward into Catherine's presidential year.
You launched the VIFs programme this year. How significant has that been for you, and what impact do you think it's had?
So I think that whole Value Improvement Finance Fellowship, it builds out of the work that we did we did a Health Inequalities Finance Fellowship, and I think the two programmes have been very allied, so it's been hugely beneficial, I think, to have people like Muir Gray, we've got a session coming up with John Seddon, we've done a session with ICHOM about outcome measurement to really elevate our thinking in that whole arena of value. So how are we going to think really differently about the fiscal climate? Isn't going to get any better. We recognise fully there's going to be even more change and technology coming over the hill that we may not be able to afford. So how we prioritise that resource, how we get into an active conversation with some of our clinical staff about how we do that really well and elegantly, and equip the HFM membership at all levels to have that conversation. We're going to have a conversation about what we do next year. The Value Improvement Finance Fellowship has still got 3 or 4 sessions to run, so I'll keep doing those if Catherine will let me. But we'll probably need to have a conversation about what do we do next, because it feels like it's an area of upskilling we all need.
Finally, as you prepare to hand over your presidency to Catherine Phillips, do you have any final reflections or messages you would like to share with HFMA members?
I'm probably going to get slightly repetitive about the HFMA members. We are a membership organisation. We recognise they are having a tough time. We recognise that, candidly, it's such an austere climate. Just people getting along to conferences is quite a tough thing. I think the main thing for us is thinking through, as an association, how can we deliver as cost effectively as possible and at cost or better all the membership services we provide. So I think in the strategy we've got a really good approach to how do we really think through that membership benefit well, how do we support bands 2 to 6s particularly well, how do we think about the role of AI well for the finance function and beyond, and that work we've absolutely got to do in that partnership working space. So I think we've got the right strategy for the next 5 years going forward. It will be great to get Catherine to spearhead some of that, so I've got a little bit more time back in the day job, but it's been a great year. It's been hard yards, both the day job's been particularly tough, toughest I've ever known, but the celebratory bit about finding success in NHS finance and supporting our membership has been a very good antidote to some of that. But it's been a great year, I think, but I'm biased.
Thank you very much, Lee. That was all.
Will that do, pal?
That's all good. Thank you very much.
We hope you enjoyed this special episode covering the first day of our 2025 annual conference. Join us soon for part 2, where we'll be focusing on the second day, centred around the 10-year plan. In 2026, the HFMA annual conference is moving to Birmingham. We'll be delivering an enhanced programme and new opportunities whilst continuing to provide the outstanding conference experience that you value, and at a reduced cost for our NHS finance community. Be among the first to secure your place at the 2026 event in its new location and be part of our biggest and best conference and exhibition of the year. You can get your tickets by following the link in the show notes. That's it for this week's episode of HFMA Talk. Thanks for listening, and don't forget to subscribe so you never miss an episode. If you've enjoyed the show, we'd love for you to leave a 5-star rating on your favourite podcast platform. See you next time.